SPARTAN is really one of the first phase 3 studies to tackle the issue of non-metastatic castration-resistant disease. It took patients with a high risk of becoming metastatic, and high risk was defined as a PSA doubling time of less than 10 months in patients who are non-metastatic based on conventional imaging. So patients were randomized 2-to-1 between apalutamide and placebo, which was the standard of care of just continuing ADT with no other therapy until patients became metastatic. And then the primary endpoint was metastases-free survival. So capturing metastases on imaging that was scheduled on regular intervals. And then the uniqueness of SPARTAN is that we followed patients until second progression. So PFS2 is quite unique. It was the first study that I've been involved in the last 30 years of studies that actually took made the effort to actually capture second progression. So we tried to understand what patients got as subsequent therapy and followed them till they progressed again, to try to get an impression as to whether starting at the time of metastases subsequent therapy allowed patients to catch up to the ones who started up front. So does it really make a difference starting in the non-metastatic state, or can we wait until metastases appear to start subsequent therapy? The other uniqueness with SPARTAN is that patients actually were offered abiraterone at the time of progression, which is really quite unique, that you didn't leave patients in limbo to figure out what to get. They were offered active agent, which was pretty much the standard of care in the metastatic CRPC setting. And in a nutshell, the results were strikingly positive. Patients who started on the placebo arm developed metastases in 16 months. Patients who started on apalutamide developed first metastases at 40 months. So a 2-year improvement in metastases-free survival. And this continued to carry over in the PFS2, where there was an over 50% improvement to time to second progression in patients who started on apalutamide compared to patients who started on placebo.